and this is Steven, and we're UCF physical therapy students. Today we're going to be showing you how to screen for benign proximal positional vertigo and also how to treat.
The vestibular system is located within the inner ear and has three primary functions. First, it stabilizes visual images on the retina during head movement. It also maintains postural stability and maintains proper spatial orientation. We will now discuss the main anatomical features of the vestibular system. First, there are the semicircular canals, which consist of three canals: anterior, posterior, and lateral canal, and these respond to angular acceleration. There is also the otolith organs, which consist of the utricle and the saccule, and these respond to linear acceleration. Within these organs is endolymph. Endolymph is a fluid that flows within the vestibular system, and this fluid moves freely within each canal in response to the direction of angular head rotation. Canals empty endolymph into the ampulla, which houses the cupula. Endolymph causes the cupula to move. Hair cells sense this movement and transmit a signal to the central nervous system. Sensation of linear acceleration works a little bit differently. Within the otolith organs, sensory hair cells project into a gel-like substance that contains calcium carbonate crystals. These crystals are called otoconia. The otoconia move in response to linear acceleration of the head, and hair cells sense this movement and transmit the information to the central nervous system. Benign paroxysmal positional vertigo, or Bppv, results when the otoconia from the otolith organs become displaced in the semicircular canals. These otoconial debris lodge in the canals and cause a disruption of endolymph flow. This disruption causes the sensory hair cells to transmit erroneous signals to the central nervous system, causing symptoms. Typical symptoms of Bppv include dizziness, lightheadedness, loss of balance, and nausea. Symptoms are almost always caused by a change in head position.
Next we're going to show you a screening technique for benign proximal positional vertigo. It's called the Dix-Hallpike position, and this screen is used to identify blockage in either the anterior or posterior canal. We're going to demonstrate it to the left side. To the left side, it would demonstrate either, if symptoms are reproduced, it would demonstrate either blockage of the left anterior canal or the posterior canal on the right side. And now we'll show you how it goes. Alright, so first you'd have the patient sitting up like this on the plinth. You're going to ask them to rotate their head 45 degrees towards the side you're testing. And then you're going to put their cervical spine into slight extension. Next, warn the patient that you're going to lower them quickly. I'm going to lower you quickly. And lower them. Once you have them in this position, you're going to look for nystagmus of the eyes, or a beating effect in the eyes. If you do see that, that's an indication that the patient may be suffering from benign proximal positional vertigo.
Okay, so now we are going to assess for blockage of the horizontal semicircular canals, which are also known as the lateral canals. And you do this with the horizontal roll test. So what you do is you have the patient in a supine position, and you have their head in about 20 degrees of forward flexion. What you're going to do is you're going to grab a hold of the patient's head, and you're going to rapidly rotate their head 90 degrees to the left. Once in that position, you're going to observe for signs of nystagmus in their eyes. If you see signs of nystagmus, you're going to hold them in this position until the nystagmus decreases or diminishes altogether. Once the nystagmus is gone, you're going to put that patient's head back in a neutral position. Then you're going to repeat the test to the right side to see if the right semicircular canals, horizontal canals, also have signs of blockage, or Bppv. So now that we've shown you the screening techniques for Bppv, it's now time to show you some of the treatment techniques that a physical therapist can do in the clinic.
Alright, so before we showed you how to screen for symptoms of Bppv and blockage that creates those symptoms using the Dix-Hallpike maneuver. We screened to the left side, indicating that the blockage, if the symptoms were present, was either in the left anterior canal or the right posterior canal. Now we're going to show you a treatment to reduce those symptoms if you do find them with the Dix-Hallpike maneuver. It's called the canalith repositioning technique. The way this is performed is that you have the patient first rotate their head 90 degrees towards the affected side. You hold this position for 30 seconds. After that, you're going to have the patient roll onto their left side. Go ahead and roll onto your left side, maintaining the position of their head in 90 degrees to the left. Hold that position for 30 seconds. Now you're going to have the patient swing their legs over the edge of the table and sit up. Taking care to maintain the position of their head. Once here, return their head to neutral. Explain to the patient that they might experience symptoms of nausea or dizziness at this point, and it may last for the next couple hours, but they should have a reduction in symptoms by the next day. If not, you can repeat this technique as necessary.
Okay, so we've already seen the screening technique for Bppv of the lateral canals. So now it's time to show you a treatment technique to reduce the symptoms. So this is called the log roll technique. What you're going to do is you're going to tell the patient to move over onto their side with their bad ear facing down. So in this case, we're going to act as if Bppv is showing symptoms of the left ear. So if we can get into this side-lying position with your bad ear down. Here you're going to hold this position for 30 seconds. And then you're going to move in, you're going to ask the patient to rotate to their right into the supine position. They're going to hold this position for 30 seconds, and then you're going to ask them to rotate a quarter to the right once again, with their bad ear this time facing up. They're going to hold this position again for 30 seconds, and then you're going to ask the patient to get on their hands and knees in the quadruped position. Make sure they're facing straight up, their head is facing straight. You're going to hold this position for 30 seconds, and then you're going to repeat the sequence 4 more times. You're supposed to be able to do this. You're supposed to do this sequence of 5 repetitions. You're supposed to do 1 set in the morning, 1 set of 5 repetitions in the afternoon, and 1 set of repetitions in the evening. Hopefully, after about a week's time, symptoms of left canal Bppv will be reduced. So now we're going to finish off with showing you a home exercise program technique that the patient can use to reduce their symptoms of Bppv. This is called the Bppv technique, and it's something the patient can do at home by themselves with just a few simple steps. So the patient's going to start in an upright position, and they're going to come down to their left side, sideline. And the patient needs to make sure that their head is rotated about 45 degrees to the right. A good way to get them to be in this position is to tell them to pretend they're staring at someone who's standing about 6 feet away, and they're staring them right in the eyes. After 30 seconds in this position, the patient will go back up into an upright sitting position. They will hold this position for about 30 seconds, and then they will lay on their side on the right side. Again, the patient's head will be in about 45 degrees of a rotation to the left side. They will hold this position for about 30 seconds, and they will come up to an upright sitting position once again. The patient should do about 10 to 20 repetitions of the Bppv exercise 3 times per day, and this should continue until there has been 2 consecutive days without Bppv symptoms.